Welcome. Today, we'll be discussing a relatively rare but important topic, urethral cancer. The urethra, the tube that carries urine from the bladder out of the body, can, in some cases, develop cancerous cells. Understanding this disease, its causes, and potential treatments is crucial for early detection and effective management. While the exact cause of urethral cancer remains unclear, several factors are thought to increase the risk. Chronic irritation or inflammation of the urethra, often due to recurrent urinary tract infections or sexually transmitted infections, is a significant contributor. Exposure to certain chemicals, particularly those found in tobacco smoke, has also been linked to the disease. In some cases, a history of bladder cancer or other urothelial cancers can increase the likelihood of developing urethral cancer. Additionally, human papillomavirus, or HPV, has been identified as a risk factor, especially in cancers of the distal urethra. The pathophysiology of urethral cancer involves the uncontrolled growth and spread of abnormal cells within the urethra. These cells can originate from the lining of the urethra, known as the urothelium, or from other types of cells present in the urethral tissue. As these cancerous cells multiply, they can form tumors that obstruct the flow of urine. In more advanced stages, the cancer can invade surrounding tissues, such as the prostate in men or the vagina in women, and even spread to distant organs via the lymphatic system or bloodstream. Urethral cancer is considered a rare malignancy, accounting for less than 1% of all cancers. It occurs more frequently in women than in men, although some studies show a near equal incidence. The incidence tends to increase with age, with most diagnoses occurring in individuals over the age of 60. Geographical variations exist, with some regions reporting higher rates than others. Further research is needed to fully understand the epidemiological factors contributing to the development of this disease. The signs and symptoms of urethral cancer can vary depending on the location and stage of the tumor. Common symptoms include blood in the urine, also known as hematuria, pain or burning during urination, or dysuria, a weak or interrupted urine stream, frequent urination, and the feeling of needing to urinate urgently. In some cases, a lump or mass may be felt in the groin area or along the urethra. Advanced stages can present with pelvic pain, weight loss, and fatigue. It's important to note that these symptoms can also be caused by other conditions, so a thorough evaluation is necessary for accurate diagnosis. Diagnosing urethral cancer typically involves a combination of physical examination, imaging studies, and tissue biopsy. A physical exam can help identify any palpable masses or abnormalities. Imaging techniques, such as cystoscopy, which involves inserting a thin, flexible tube with a camera into the urethra, can visualize the urethra and bladder. Urine cytology, where urine samples are examined for abnormal cells, may also be performed. However, the gold standard for diagnosis is a biopsy, where a small tissue sample is taken from the suspicious area and examined under a microscope to confirm the presence of cancerous cells. Urethral cancers are often classified based on the type of cells they originate from. The most common type is urothelial carcinoma, also known as transitional cell carcinoma, which arises from the lining of the urethra. Other less common types include squamous cell carcinoma, adenocarcinoma, and melanoma. The location of the cancer within the urethra, whether it's in the proximal middle or distal part, is also a factor in determining treatment strategies. Treatment for urethral cancer depends on several factors, including the stage and location of the cancer, the patient's overall health, and personal preferences. Common treatment options include surgery, radiation therapy, and chemotherapy. Surgery may involve removing the tumor and surrounding tissue, and in some cases, the entire urethra or bladder may need to be removed. Radiation therapy uses high-energy rays to kill cancer cells. Chemotherapy uses drugs to destroy cancer cells throughout the body. Often, a combination of these treatments is used to achieve the best outcome. Emerging treatments like immunotherapy are also being explored. While there is no guaranteed way to prevent urethral cancer, certain lifestyle choices can help reduce the risk. Avoiding tobacco use is crucial, as smoking is a known risk factor. Practicing safe sex and getting vaccinated against HPV can help prevent infections that can contribute to the development of the disease. Managing urinary tract infections promptly and avoiding chronic urethral irritation are also important preventative measures. The prognosis for urethral cancer varies depending on the stage at diagnosis, the type of cancer, and the patient's overall health. Early detection and treatment are crucial for improving outcomes. Recent research is focused on developing more targeted therapies and improving early detection methods. Clinical trials are ongoing to evaluate new treatment approaches, including immunotherapy and targeted therapies, which offer hope for improved outcomes for patients with urethral cancer. It's crucial to discuss individual prognosis and treatment options with a qualified medical professional.